Imagine this. You're just standing there, totally fine, 1 second, and then bam, the whole room isn't just tilting. It feels like something is literally, violently throwing you onto the floor.
Yeah.
Your world spins, your stomach just plummets, and this wave of panic washes over you.
Yeah.
It's definitely not just dizziness, it's something much more intense, completely disorienting, leaves you totally confused.
Yeah.
That feeling, that's real vertigo.
And that's exactly what we're going to dig into today. Our mission really is to get clear on what true vertigo actually feels like, separating it from just feeling generally dizzy or a bit unstable.
Right.
We want to pinpoint the root causes, and some might surprise you. They go way beyond just the physical. And then, importantly, look at ways to manage it, both conventional medicine and more natural approaches. We've pulled from a lot of integrative health research for this, so our sources give a pretty comprehensive, sort of integrated, picture-specific therapies, supplements, the whole deal, really aiming to give you a full toolkit for navigating this.
Okay, let's unpack that first bit then. When people say dizzy, it covers a lot, right? Feeling lightheaded, maybe just a bit off kilter. How is true vertigo really different? You mentioned that dramatic feeling, like being thrown down. It's not just feeling woozy, like maybe you had one too many.
Exactly. That thrown to the floor description really nails the intensity. It's not like lightheadedness where you might feel like you're going to faint. True vertigo is this powerful illusion of motion. Either your surroundings are just uncontrollably spinning around you, or you feel like you're the one spinning wildly.
Oh.
And these attacks, they often hit out of the blue. Sometimes it's a simple change in position, getting out of bed, standing up from a chair, even just looking up quickly. And they usually come with other things, too. A serious loss of balance, feeling sick to your stomach, sometimes sweating, looking pale. And because it's so disorienting, so terrifying, really, it's very strongly linked to anxiety. Panic attacks are common during an episode.
Yeah, I can imagine. So if the world feels like it's spinning that violently, it sounds like a very specific part of our body must be involved. It's not just the general feeling unwell kind of thing. What's actually going on inside us to create something so dramatic?
You're spot on. Fundamentally, true vertigo usually points to a problem within your vestibular system.
Okay.
You can think of that system as your body's own internal gyroscope and GPS, basically. It's constantly telling your brain where your head is and how it's moving in space. It's what keeps you balanced and oriented.
An internal gyroscope. Okay. So what makes up this system? What are the key parts?
Well, it's mainly located deep inside your inner ear. You've got these 3 semicircular canals. Imagine tiny looped tubes filled with fluid, kind of like snail shells, arranged in different directions.
Okay.
Plus, there are 2 little sacs called the utricle and the saccule. Now, the canals mostly detect rotational movements, like turning your head. The utricle and saccule pick up on linear movements, like accelerating in a car or going up in an elevator, and also gravity. Inside all these structures, there's fluid and tiny hair-like sensors. Vertigo happens when something goes wrong here. Maybe the fluid balance gets messed up too much, too little, maybe it gets too thick, or those little sensors start sending faulty signals, your brain gets confused messages about movement, and boom, vertigo.
Right, okay. But here's where it gets really interesting, doesn't it? Because it's not always just a simple glitch in the inner ear mechanics. What are some common diagnoses people get? And what are those maybe less obvious underlying drivers we should be aware of?
Yeah, this is key. A very common diagnosis you hear is Meniere's syndrome.
Right, I've heard of that.
And that relates directly to what we just talked about, an imbalance in that inner ear fluid, often leading to pressure buildup. But the crucial question is why? Why is that fluid balance off? And what we often find, looking deeper across many conditions, is an underlying inflammatory process.
Inflammation again. It seems to come up everywhere.
It really does. And it's not just vague inflammation. Chronic inflammation can subtly damage those delicate nerve pathways and the mechanisms regulating fluid in the inner ear. It creates this persistent state of imbalance.
So inflammation is a major player. What else is common?
Another big one is benign paroxysmal positional vertigo, BPPV for short.
Okay.
Now, this one isn't about the fluid. It's about those sensors, or rather tiny calcium crystals called otoliths. Normally, these little crystals live in a different part of the inner ear, kind of embedded, but sometimes they break loose. And they can drift into those semicircular canals where they don't belong.
Right.
So when you move your head in certain ways, these loose crystals shift around in the canal fluid, bumping the sensors and sending a powerful false signal to your brain that you're spinning.
So your brain is getting totally conflicting information.
Exactly. Imagine your eyes are telling your brain everything's still, but these rogue crystals are screaming to your inner ear, "We're spinning!" And your cerebellum, which tries to make sense of balance, gets confused. Your proprioceptors, the sensors telling you where your body is in space, are also sending conflicting signals. This massive sensory mismatch is what causes that horrible falling or spinning sensation, and often sheer panic.
That makes sense. It sounds like a very specific mechanical problem. But this leads to something even deeper, I think. How connected are our minds and bodies here? We sometimes dismiss stress as, it's all in your head. But you're suggesting stress, and even trauma, can physically trigger vertigo. How does something like unassimilated trauma actually cause a physical short circuit like that?
It's a profound connection, and honestly, it's overlooked far too often. Chronic stress or significant psycho-emotional trauma that hasn't been processed, maybe ongoing relationship turmoil, dealing with something like financial fraud or even deep-seated events from the past. These things can keep your autonomic nervous system in a constant state of high alert. That's the system controlling things like blood flow, heart rate, and importantly, inflammation. When trauma isn't, let's say, digested or integrated, we experience it, but we can't fully process or accept it. It's like the fight or flight switch gets stuck on.
Right.
This constant stress impacts the vagus nerve, which is huge for the gut-brain connection, but also heavily involved in regulating inflammation all over the body, including the inner ear. So this sustained stress response fuels systemic inflammation. And as we saw with Meniere's, that inflammation can directly mess with the delicate structures of the vestibular system.
So stress creates the environment for the vertigo to happen.
In many cases, yes, it can make the system more vulnerable. It can even push the immune system to become overactive, potentially leading to autoimmune responses where the body attacks parts of the inner ear. And of course, things like a poor diet, not moving enough, and especially lack of deep sleep, they all pour fuel on that inflammatory fire.
That connection is really powerful. And what about infections? Can they cause it too?
Yes, definitely. We shouldn't forget that. A viral infection, for instance, can directly attack the nerves or structures within the inner ear. That can certainly trigger vertigo. Sometimes blood tests can help identify if an infection is involved.
Okay, so knowing the why, whether it's crystals, fluid, inflammation, stress, or infection, that's huge. It gives us clues about what to do.
Yeah.
So once you have a better idea of the root cause, what are the practical steps? How do you start rehabilitation?
Well, the absolute foundation, especially if inflammation is suspected, starts with basic daily habits.
Right.
Primarily diet,
Right.
reducing inflammatory foods, sugars, processed stuff, and upping nutrient-dense foods is critical. Seriously, without addressing the diet, other therapies might just be temporary band-aids.
Makes sense. What else?
Then you have specific manual therapies and what's called vestibular rehabilitation. These aren't just generic balance exercises you might find online. They are very precise movements, sometimes designed to, for example, gently reposition those loose crystals in BPPV, like the Epley maneuver people might have heard of, or to help your brain adapt and compensate for faulty signals.
So you need a professional for that.
Ideally, yes. It's really important to work with a therapist, maybe a physical therapist or chiropractor, who understands these specific techniques and has that integrative view we talked about. They can diagnose properly and, crucially, teach you exercises you can safely do at home. Consistency with those home exercises is really key for retraining the system.
Okay. Now, you mentioned psycho-emotional trauma being a potential trigger. That seems like it needs a different kind of approach. I've heard about EMDR. What exactly is that? How does it fit in with something physical like vertigo?
Right, EMDR, that stands for eye movement desensitization and reprocessing. It's a fascinating psychotherapy technique. It uses guided eye movements, a bit like the rapid eye movements that happen naturally during REM sleep, when our brain processes the day's events and emotions. The idea is that these specific eye movements help the brain reprocess distressing memories or trauma. It helps to kind of lower the emotional volume attached to the memory, allowing it to be integrated in a less disruptive way.
So if unassimilated trauma is contributing to that stuck stress response we talked about.
Exactly. If that's creating the physiological short circuit that contributes to inflammation or nervous system dysregulation affecting the inner ear, then EMDR can potentially help rewire those pathways.
Is that something you can do yourself?
Professional guidance is definitely best for deep EMDR work. But there's a simplified principle you could carefully try at home. If you notice a specific difficult thought or image keeps popping up, focus on that thought while looking hard to your left, then quickly shift your eyes to look hard to the right. Repeat that a few times. Sometimes just that bilateral stimulation, that rapid eye movement, can help take the edge off the thought's intensity. But again, for real trauma processing, professional help is the way to go.
Got it. And what about general stress management?
Absolutely crucial. Practices like mindfulness, guided meditation, specific breathing exercises, things like box breathing or diaphragmatic breathing, are incredibly powerful tools. We also often recommend looking into heart coherence practices. These techniques help create a more stable, rhythmic pattern in your heart rate variability.
Heart coherence.
Yeah, it sounds technical, but it basically signals safety and calm to your entire nervous system. Achieving that state can have a really positive downstream effect on managing stress and potentially those vestibular issues triggered by stress.
Okay, so we have lifestyle changes, specific exercises, potentially trauma therapy. What about things you can actually put into your body? Supplements, maybe? What can help fuel recovery or support the system?
Yes, definitely. But first, I have to reiterate the nutrition piece. It really needs to be a lifelong plan.
Not just a quick fix.
Not at all. Managing inflammation through diet isn't temporary. I've seen so many patients improve, then relapse because they slipped back into old eating habits that fueled the underlying inflammation. It has to be consistent.
Okay, noted. So beyond diet, what supplements might be helpful?
There are several that often come up in integrative approaches. Vitamin D, usually paired with vitamin K2, is important for calcium metabolism, how your body handles calcium. That's potentially relevant for those otolith crystals, right?
Makes sense.
Magnesium is another key one. Specifically, a form called magnesium threonate seems unique in its ability to cross the blood-brain barrier effectively.
Ah, so it can actually reach the inner ear and brain.
Precisely, which is important for nerve function and calming the system. Then there's ginkgo biloba. It's well known for helping improve blood flow, including the microcirculation in the brain and inner ear. Better blood flow means better delivery of nutrients and oxygen, and better removal of waste products.
Okay.
Coenzyme Q10, or CoQ10. Think of this as fuel for your mitochondria, the tiny energy factories inside your cells. The inner ear system has high energy demands, so supporting mitochondrial function with CoQ10 can be beneficial.
Right.
If stress is a big factor, ashwagandha is a great adaptogen. It helps your body become more resilient to stress overall. Adaptogen, meaning it helps you adapt.
Sort of, yeah. It helps modulate the stress response rather than just suppressing it. And one more, perhaps slightly unexpected, 5-HTP. If someone finds their vertigo seems linked with digestive issues, particularly constipation, 5-HTP might be worth considering. It's a precursor to serotonin and can positively impact the gut-brain axis communication via the vagus nerve.
Interesting connection there between the gut and balance.
It's all connected. And speaking of connections, we absolutely have to mention sleep, especially deep sleep.
Why is deep sleep so important here?
Because getting enough deep sleep consistently, more than about 6 hours of total sleep, is the primary time your brain performs its cleaning cycle. It uses something called the glymphatic system to flush out metabolic waste products that build up during the day.
Like a nightly brain detox.
Exactly. And clearing out that toxic buildup is vital for overall neurological health, including the parts that manage balance. Poor sleep can really impair that cleaning process. Okay, this is already a lot of interconnected factors, but you might be thinking, is there anything else? Could my neck pain be related? What about my jaw? And surprisingly, the answer might be yes. Are there other, less obvious physical connections we need to think about?
Oh, absolutely. The body is incredibly interconnected. Issues coming from your neck, your cervical spine, or even your jaw, the temporomandibular joint, TMJ, can definitely influence vertigo.
How?
Well, think about all the crucial blood vessels and nerves that pass through your neck to supply the head and brain, including the inner ear structures. If there are misalignments or restrictions, say, in the joints at the very top of your neck where it meets the skull, the cervico-occipital area, it could potentially interfere with nerve signals or blood flow related to balance.
Okay, and the jaw.
Same idea. Things like bruxism, chronic teeth grinding, or clenching missing teeth that change your bite, maybe even old mercury amalgam fillings or untreated cavities. These can create tension and dysfunction in the jaw joint and surrounding muscles. There's a major nerve, the trigeminal nerve, that's heavily involved with sensation in the face, jaw function, and it has connections within the brainstem close to vestibular processing centers.
Wow.
So irritation or dysfunction signals coming from the jaw or dental issues traveling along that nerve could potentially spill over and interfere with balance control, triggering vertigo in some people.
So a dentist or a chiropractor might actually be part of the assessment.
In some cases, absolutely. It really highlights why a thorough, comprehensive evaluation is so important, looking beyond just the inner ear itself to consider the whole interconnected system.
Okay.
Yeah.
So wrapping this up, what does this all mean for you, the listener?
Yeah.
We've really dug deep today. We've talked about how true vertigo feels that intense, disorienting spinning. We've explored the complex causes, from the mechanics inside your ear, like fluid or crystals, to the really profound impact of things like systemic inflammation, chronic stress, even unprocessed trauma.
Yeah.
And we've looked at a whole range of integrative strategies, specific exercises, therapies like EMDR, crucial lifestyle factors like diet and sleep, supplements, and even those surprising links to your neck and jaw health.
It really does encourage us all, I think, to appreciate just how interconnected our health is, that something as debilitating as vertigo might not be just an isolated ear problem. It could be a signal, a message from a deeper imbalance within the system. And it leaves you with a thought, doesn't it? If our bodies are this connected, if a stressed mind or an inflamed gut or a misaligned jaw can potentially throw off our sense of balance, what other symptoms we experience, things we might dismiss as isolated issues, could actually be whispers from a much broader systemic need for healing and integration. Something to think about.